Hello everyone, so we're first going to introduce our group members, Angela, Gerson, Ivy, Kyanh, Megan, and Nicole, and today we will be talking about an important global health topic, child abuse. Child abuse is a global problem with serious lifelong consequences. But before we start, we must first know, what is child abuse? Well, according to the CDC, child abuse is defined as all types of abuse and neglect of a child under the age of 18 by a parent, caregiver, or another person in a custodial role, such as a coach or a teacher, that results in harm, potential for harm, or threat of harm to a child. Now, there are 4 common types of abuse and neglect. The first is physical abuse, which is intentional use of physical force that can result in injuries. Examples include hitting, kicking, shaking, burning, or other shows of force against a child. Sexual abuse involves pressuring or forcing a child to engage in sexual acts. It includes behaviors such as fondling, penetration, and exposing a child to other sexual activities. Emotional abuse refers to behaviors that harm a child's self-worth or emotional well-being. Examples include name-calling, shaming, rejection, withholding love, and threatening. Neglect is the failure to meet a child's basic physical and emotional needs. These needs include housing, food, clothing, education, and access to medical care. Now let's get into some statistics. In the United States alone, nearly 700,000 children are abused every year, and in 2015, 1,670 children died from physical abuse and neglect, which are the most common forms of daily child abuse. And in most cases, the abusers are someone known to them, so it could be their parents or a caregiver. And in the United States, about 4 out of 5 abusers, or 80%, are the victim's parents. Globally, 1 billion children aged 2 to 17 experienced child abuse in the past year. Now, this includes all forms, so physical abuse, sexual abuse, emotional abuse, and neglect. The top 10 countries are all in Africa, largely in its western and central regions. And the most common forms of child abuse in Africa are physical abuse, due to child labor, sexual abuse, where one child is raped every 3 minutes, and neglect, due to the extreme poverty and inability to supply adequate food for their child. Niger is considered the most dangerous for children, followed by Mali, the Central African Republic, Chad, South Sudan, Somalia, Nigeria, Guinea, Sierra Leone, and the Democratic Republic of the Congo, in that specific order.
Child abuse is not linked to one direct cause. It is a combination of individual, relational, community, and societal factors. According to WHO, a few risk factors associated from a child's perspective is that they are unwanted, they demonstrate poor behaviors, an example acting out or showing aggressive behavior, or having special needs or having abnormal features, such as being born with a unique facial structure, having an illness, and so on. This can lead for the abuser to mistreat the child as they are not quote-unquote normal or the average child compared to others. Standing from a parent's or caregiver's perspective, some determinants are having a difficult time bonding with a newborn. Many mothers face PTSD or can't find that connection or attachment at first with their child. This may lead to neglection, abandonment, or no will to bond with the child. Other reasons for child abuse is that the parent or caregiver have been maltreated themselves and/or they are misusing alcohols and drugs. Moving on to characteristics of relationships within families or among intimate partners, possible reasons could be violence and aggression between other family members. As well as being isolated from the community, this could lead one to act out or become violent towards the child. Based on the community and societal factors, poverty or areas with high unemployment demonstrates a higher rate in child abuse. In addition, based on these community factors, child abuse could be a social norm and cultural norm. Based on these risk factors, the detrimental behaviors and acts can ultimately have a tremendous impact on future violence victimization and perpetration and lifelong health and opportunity, which is also known as adverse childhood experiences. CDC states that the child may suffer from not immediate physical injuries, but emotional and psychological problems as well. For instance, they may become drug addicts or become alcoholics to escape their pain. They may be delayed brain development, have reproductive health problems. They may also contract STIs if they were sexually abused. All these factors can greatly influence their perspective on life, as they may have difficulty finding and building relationships with other people, finding jobs, finishing school, and contributing to society. These consequences from child abuse can be prevented and helped.
There are strategies and approaches proven to impact individual behaviors as well as family, community, and societal factors that influence risk and protective factors for child abuse and neglect. Strategies that are intended to work in combination in a multi-level, multi-sector effort to prevent child violence are strength economy, supports to families. This means strengthening household financial security and family-friendly work policies. Change social norms to support parents and positive parenting. These are public engagement and enhancement campaigns and legislative approaches to reduce corporal punishment. Provide quality care and education early in life, which includes preschool enrichment with family engagement and improved quality of childcare through licensing and accreditation. Enhance parenting skills to promote healthy child development. This makes reference to early child home visitations and parenting skills and family relationship approaches. Lastly, is to intervene to lessen harm and prevent future risk. For example, enhance primary care, behavioral parent training programs, and treatment to prevent problem behaviors and later involvement in violence. Protective factors may lessen the likelihood of children being abused or neglected. Identifying and understanding protective factors are equally as important as researching risk factors. According to the Center for Disease Control and Prevention, there are different types of protective factors. There are family protective factors and community protective factors. Family protective factors are supportive family environments and social networks, concrete support for basic needs, nurturing parenting skills, stable family relationships, household rules and child monitoring, parental employment, parental education, adequate housing, access to healthcare and social services, and caring adults outside the family who can serve as role models or mentors. On the other hand, community protective factors are communities that support parents and take responsibilities for preventing abuse.
So now we're going to talk about child abuse and its relevance to global health. Many of the risk factors that are associated with child abuse are centered on or are impacted by economics and income. Continued gap that grows between low income and high income groups continues to widen, allowing for issues with child abuse to persist due to children having to start working at a younger age, parents lashing out at their kids more due to stress from having to work longer hours, living in poorer conditions that leads to more of a strain in the relationship between parents and children, and then also just children being exposed to violence through gangs and other crime and stuff like that. So this ends up leading to lower income communities and nations being disproportionately impacted by child abuse. Since these lower income communities and nations also have a lower access to resource, this ends up leading to a cycle that allows for child abuse to continue to persist in lower income communities and nations. So, in order to prevent and reduce the prevalence of child abuse worldwide, the World Health Organization has coordinated a response to child abuse that focuses on laws. So, implementing and enforcing laws, for example, those that would ban violent discipline from parents to children and restricts access to alcohol and firearms, and also adjusting norms and values that exist in cultures, for example, norms that would condone sexual abuse of girls and also aggressive behavior amongst boys, creating safe environments, such as identifying neighborhoods or communities that might have hotspots for violence and then addressing these causes locally through different policies and interventions, and then also providing parental and caregiver support. So, providing parent training to the young, and then also training for parents who are first time parents, and then also income and economic strengthening, such as like gender equity training, and also just empowering low income communities to improve their income situation. And then also providing response services, for example, for children who have been exposed to violence, giving them access to effective emergency care and helping them receive the appropriate psychosocial support,
And finally, providing education and life skills, such as ensuring that children attend school and provide life and social skills training to children.
The World Health Organization created the Sustainable Development Goals for 2030. It aims to improve the health and quality of human lives around the world and improve the status of Earth's natural environment. Their 16th goal focuses on promoting peaceful and inclusive societies for sustainable development, providing access to justice for all, and building effective, accountable, and inclusive institutions at all levels. A specific target of the 16th goal aims to end the abuse, exploitation, trafficking, and all forms of violence against and torture of children. Here is a chart of 60 countries ranked on how safe their environment is for children. A score of 100 means that the country effectively protects children against all forms of abuse. The top half of the ranking is dominated by high-income countries like the UK, South Korea, and Peru. In turn, the bottom half of the rank has many low-income countries like Mongolia and Ethiopia. This trend can be explained by how the countries were scored on certain criteria. To be considered safe for children, a country must have a secure environment against armed conflict and social unrest, legal framework to determine child protection laws, government commitment and capacity to handle the implementations, and the engagement of industries, civil society, and media on the issue. Because these categories are complex institutions of their own, improving and maintaining them requires an abundance of resources that unfortunately many low-income countries cannot afford. The lack of institutions and public services in many low-income countries causes the prevalence of child abuse, such as children being stuck with their abusers. Many are taken as victims in human trafficking, and most commonly, boys being overlooked as victims themselves.
Overall, in conclusion of our presentation, just to review what we talked about, we went over the different types of child abuse, which is extremely important in identifying, so that different and proper therapy and recovery resources can be used. We went over the prevalence of child abuse in the United States, around the globe, and in different kinds of income level environments, and more. We talked about common risk factors that might predispose children to child abuse that everyone should look out for, as well as some prevention measures that we could take. We also went over how much of an impact child abuse can be on a kid, how incredibly important that we recognize it so that we can protect them, ourselves, and the future. Furthermore, here is some additional information in the case that you have, currently are, or is suspecting of prevalence of child abuse in your life. Here is the National Domestic Violence Hotline that you can call anytime on any day. These confidential and free calls can provide you and or the affected party with the best possible support. If you feel that the situation is extremely violent and help is needed immediately, please call 911. There are other services from the National Domestic Violence Hotline website if you would like more information. Now that we have presented our information about child abuse, here are some post-PowerPoint questions to consider. First, do you remember what the 4 different types of child abuse are? Well, if you didn't, then feel free to look back on our presentation, but the 4 different types of child abuse are physical, sexual, emotional abuse, and neglect. Next, how do you determine whether or not you are experiencing or witnessing child abuse? So the first step towards help would be identifying if you are the victim or you see a victim of child abuse. Some key indicators would include injuries, frequent visits to the school nurse, hospital, and care centers, destructive, aggressive, or disruptive behavior, passive, withdrawn, or emotionless behavior, fear of going home or fear of parents, obvious malnutrition or fatigue, and frequent absences from or tardiness from school. Finally, how much of an impact do you think that child abuse will increase or decrease in the future? There is no right or wrong answer, but this open-ended discussion question intrigues future research in identifying, preventing, and dealing with child abuse cases. Through our group's research and analysis, child abuse may become a less prevalent issue. Through this current world's pandemic situation, the safety of the health of children is considerably under heavy control and patrol from parents and guardians. With quarantine and stay-at-home orders, children may be considered to be safely at home. In the case that a child is within a home that is inflicting child abuse towards them, help is a 911 call away or on the National Domestic Abuse Hotline. Here are the references and sources that we use throughout our presentation if you'd like to check them out for more information. Thank you so much for watching!